Hey, good afternoon, everyone. So thank you again for joining today's group chat session. So today's topic will be about men's health and support. So my name is Moise. I'm the peer support assistant at the HopeSpring Cancer Support Center. So before we actually get started into the content of the session, I'd just like to hear a little bit about those who registered, so Dave, and a little bit about Gary and Sean as well. So just if you can provide a brief background about yourself, and let us know what your hobbies are and what is your most memorable experience. So I can get started. So a little bit more about myself. I completed a bachelor's in health sciences and a master's in public health, and currently I'm working as a peer support assistant at HopeSpring. I really enjoy helping people, supporting people as best I can. And some of my hobbies include playing sports. I really enjoy playing basketball with friends, going to the gym once in a while, and kind of exploring different areas in nature. That's something that I really enjoy doing. One of my most memorable experience, I would say, is the time when I went to Alberta for the first time to the Banff National Park. I went there to canoe, and it was actually a very nice scenic kind of place that I went to. And that was something that that I would never forget. It's a really amazing experience that I had. So yeah, that's a little bit about myself. So anyone else? What next?
I'll jump in.
Sure.
My name's Gary McCray. I'm a 7-year prostate cancer survivor. I'm married. I have 2 children and 4 grandsons. I retired 5 years ago. So I was diagnosed in December of 2015. And then I had the surgery in 2016. And shortly after that, I discovered that the support group actually existed. I didn't know it existed prior to having surgery. So I joined that group probably in fall of, I would guess, 2016. And I found it really, really helpful to meet other guys that have been going through a similar experience that I had. One of the most memorable things I have is had surgery in April, but we had planned a trip to Italy that summer. So I was okay. I was able to go on a trip. We went with another couples. We were like almost 2 weeks in Italy. Was a lot of fun, but I'll share an experience. I was still wearing Depends because of the surgery. So that was a interesting challenge. Anyways, all good. As I said, I joined the support group about 7 years ago now, and maybe 3-4 years ago, I joined the steering committee as well. I could talk about our group now, or do you want to do it later, or how do you want to handle that?
Oh no, you'll have your own
So
presentation
that's
session.
kind of my background. I've been retired 5 years. I worked in the apparel industry for many years. I was a buyer of the Bay for quite a while. Then my most recent, before I retired, I was working for Wrangler Jeans as an account manager. So that's kind of my background.
Yes, great. Thanks for sharing, Gary. Let's go next.
Awesome.
I can go.
Sorry, go ahead.
Oh, okay. Sorry, Dave. I'm Sean Sikowski. I have been facilitating the men's support group at HopeSpring since 2017. I am a cancer survivor as well. I was diagnosed with a type of lymphoma in 2000. Went in and out of treatment for nearly 6 years and have been in remission since 2006. In 2007, I felt the need to give back to the cancer community, so I started volunteering in some different ways, including peer support, including facilitating support groups, starting a local chapter of a lymphoma patient organization in the Waterloo region. And for the last 10 years, I've been doing work with lymphoma patient organization as a career change. So my cancer experience has really shaped the direction of my career and volunteering efforts. I'm an outdoors person, so I love spending time outdoors, doing camping, fishing, biking, anything that helps keep me active. And my most memorable experience would have to be the birth of my daughter, who's 9 years old. And there were a lot of uncertainties with, being able to have children following treatment and whatnot, but look at that experience as a miracle. So that's what stands out the most.
Great, great. Thanks for sharing.
Thanks.
Great.
That's awesome. So my name's Dave Wynn, and I survivor of colorectal cancer. I had my surgery in January 2022, and so that was my last time in hospital. Since then, I've had just been doing tests and monitoring and all that kind of thing, and so far so good. This is my first time joining to peer support meeting, so yeah, it's great. Work-wise, I actually had some struggles with work as well. I own my own business during COVID, started my business in 2017, and had to end my business in 2021, just after I was diagnosed. And that was a retail store. I actually ran in Kitchener pretty much by myself. So yeah, that's changed for me. I have years of retail management experience. So I did a little bit more of that. I worked at Lowe's for about 6 months, and from the fall to recently. But actually, I'm starting a new job next week, and that's in HR. So I've moved my career path more to office work, administration type work, and so I'm going to be an HR assistant at a company in Cambridge. Be starting next week, so I'm looking forward to that. So yeah, I'm a pretty busy guy, going to school and doing part-time courses through Conestoga as well for HR. So it's been a new thing for me. And yeah, as far as sort of my hobbies and things that I enjoy, I'm big on outdoors as well, and camping and that kind of thing. I have a kayak and do quite a bit of that. Cycling and getting outdoors and camping and fishing is all things that I enjoy. Yeah.
Great,
Hi.
thanks so much. Yeah, Noelia.
Yeah, sorry. Hi there. My name is Noelia. I am the Member Services Programming and Volunteer Lead at HopeSpring. I've been with the organization since 2019, just before COVID started. Funny thing is, I'm also studying HR at University of Toronto. And so my hobbies would be, I like to go swimming. And what most memorable experiences, I just I'm not there yet, but I'm almost completing my courses. I think there's 9 courses that we have to do, and I think I've done maybe 5 or 6 so far. So hopefully I can finish that and get going. But yeah.
Great. Yeah, thank you so much, everyone, for sharing a little bit about yourself. It's really good to briefly know each other before we actually get into the content today. So let's get started here. So before we actually go into Gary's presentation and Sean's presentation, just a little brief introduction about today's topic. So today, like I said, we'll be discussing on men's health and support. So research studies have shown that fewer men compared to women attend support groups, right? So research studies, several of them have shown that. And some reasons may be that that men take their cancer diagnosis and its effects more personally, right? And because of this, they may feel less comfortable sharing their experiences with others. So a cancer diagnosis may also make men appear emotionally vulnerable, which can be taken as a sign of weakness, right? So there are other personal and societal reasons which may contribute to men's lower attendance to support groups. So a comprehensive support group system, which includes a strong network of support, can provide great informational and emotional support for men, and have the potential of providing male patients with ready access to treatment options with their healthcare providers. So having that support network going on through the support systems, through the support groups, men can learn more about what options they have in terms of treatment, and what other programs are there out there that they can be involved with. Okay. So just a brief introduction I just wanted to give. So with that said, I just wanted to get into sharing experiences, right? So I have some questions here prepared for all of you today. So we'll go step by step over each question, and we can get each question answered as we go. Okay, so number one, I just wanted to hear from those who were here today. Have you experienced any barriers in getting support you were looking for? And did you experience any form of stigma by joining support groups? How did you feel about your cancer diagnosis and treatment? So initially, when you heard about your cancer diagnosis and the treatments that you're going through, how did you feel about that? And what are some coping mechanisms that helped you? Okay, so anyone who can feel free to start answering these questions.
I can start with a couple.
Sure.
So I was diagnosed as a young adult at the age of 25, and I think one barrier that I found was accessing support that could identify with people in my age group. A lot, because of the demographic for cancer can be seen as mainly in older people. I found that specific supports available for younger people going through cancer at that time were lacking. And I found that to be a barrier. How did I feel about my cancer diagnosis and treatment? I was being so young and not having any previous health issues. I was taken by surprise with the diagnosis. And with the type of lymphoma I had, it was very hard to treat. So there was a lot of continued stress and anxiety because I wasn't getting the response from treatment initially that I was hoping for. And just feeling like I was in and out of the hospital all the time. There was, I didn't see, for a while, I didn't see an end in sight to this. And the coping mechanisms that helped me the most were peer support, which is why later I got into volunteering in that space, because I was finally able to connect with somebody that not only had the same type of cancer, but was relatively in the same age group. So their experiences mirrored a lot of mine, and they were able to provide some of that relevant support that helped me greatly.
Great. Thanks for sharing, Sean. Did you experience any form of stigma by joining support groups initially?
I did not.
No. Okay.
I did not, which is why I
Great.
did that.
Okay, great. Thanks for sharing, Sean. Okay, would like to go next.
Sorry, go ahead, Dave.
Yeah, sorry. Yeah, so this is my first time joining a group. I just decided, I was looking into it a few months ago in terms of trying to find people who had some of the same experiences or some of the same, I guess, experiences to connect with, kind of thing. I looked online quite a bit, so I did a lot of looking on Facebook and found some groups for very specific things related to my condition, and he got some pretty good information there. I find Facebook kind of a big sort of free-for-all in terms of conversations and things, and not necessarily the most productive thing in the world. So I find it a bit hard for me, but I get some good piece of information. No real stigma, of course, joining this or any of that kind of thing. But my diagnosis and treatment was obviously a big surprise for me. I grew up in a family where my father was ill most of my life. He had chronic active hepatitis, and he had 3 liver transplants and 2 kidney transplants, actually. So I'm very familiar with illness and health and you know, the value of supporting each other and going through that. And didn't really think it would happen to myself so early. So yeah, that it was a big scare for me, and still, you know, a lot of things to go through. But yeah, treatment was actually really pretty cut and dry, and I found, you know, everything that happened as far as chemo and radiation and surgery and everything went pretty smoothly for me. I was stage 3 colorectal cancer, but things went pretty well that way. So I'm very lucky, feel very lucky and happy about that. Coping mechanisms have really been a number of things. It's been kind of relearning some things, reconnecting with some music just to try and relax at certain times, and reconnecting with friends and conversations that way. Yeah, just kind of reaching out to people around me when I'm, you know, kind of feeling blue and that kind of thing has really helped me. Yeah.
Great. Thanks for sharing, Dave.
I could talk about my experience a bit. I didn't see any barriers in getting support, and there was really no stigma about joining a group. The only comment I would make is I wish I'd known about the group earlier than later. My cancer diagnosis was kind of a shock in a sense, but I've been going through PSA testing and my numbers were climbing a little bit. So the diagnosis itself wasn't a total surprise. The treatment that was discussed with the surgeon in Hamilton was kind of, well, surgery is probably your best option. At the time, I didn't really understand other treatments might have been available. Not to say that I was a candidate for other treatments, but I just didn't have the knowledge about what else was available at the time, which I think is very kind of important for guys who do get diagnosed, that it's not necessarily just surgery, there's other options. Coping mechanism, I was very fortunate. I have a very strong family support. My wife's been terrific. I found that when I joined the support group and guys were all sharing their experiences, that often I was experiencing the same thing as other people. So that kind of made me feel a little bit better, I guess. And then the other thing that comes into play is depression, having to deal with that. And then I think that's all part of the experience of having any kind of cancer, I guess. But that was my own personal experience. So that's really where I'm at with it.
Great, yeah. So thanks again for sharing your personal experiences. So of course, it's you know, everyone has different ways of coping with their unique you know, circumstances and condition. So it's really, you know, great to hear from all of you about how you found different ways of coping, and also like you know, what ways and what kind of barriers or avenues you used to find support. So with that said, next slide, I wanted to bring in Gary again. So Gary, I just wanted you to talk a little bit more about the prostate support group, right? So if you can just start off with an overview of the prostate support group. So just describe how you run the group and all the details regarding this prostate support group. And you also touched a little bit on the PSA testing. So you know, can you also provide more details on your experiences with your PSA testing, and how did you feel after surgery? right? And what are the values and benefits of family support?
The support group started about 20 years ago. It was actually kind of a spin-off from HomeSpring itself. Two fellows started it, Michael Wilson and Glenn Tolhurst. Unfortunately, Glenn passed away last summer. Michael is still active with our group. He's in his mid 80s now. So they started the group, as I said, about 20 years ago. At that time, Prostate Cancer Canada existed, although they really didn't have anything to do with support groups. They did provide a lot of literature and things that were available for anybody experiencing prostate cancer. Our group's main focus today is to provide community outreach or communication to the community as well as support. We were doing quite a bit of community activities, such as setting up a booth at the RV show, in the local Y, giving talks at the Lions Club, the car show in Waterloo. All of those activities were pre-COVID, of course. We haven't really been able to get back on track really since COVID is lessening, if you will, or things are opening up a little bit more. One of the things we do talk about quite a bit as a group is PSA testing. We are really advocates for having that done. We encourage guys to get PSA testing at age 40. And from a lot of my own experience is that, and I'll share that, my number was about 4, which is pretty well the average in North America for guys. And then it started to climb a little bit to 6. And it was over about 2 years that my numbers were increasing a little bit. So my family doctor sent me to a urologist. They did more testing than I had a biopsy, which indicated that I had prostate cancer. And they in turn referred me to a surgeon in Hamilton at St. Joseph's Health Center. And I ultimately had my prostate removed laparoscopically. But again, back to the PSA testing, what we're encouraging men to do, first of all, guys don't like going to doctors. We all know that. But if you can start getting tested at age 40, you set a baseline to what your number is, and then you can monitor it over time. So I have a 40-year-old son. I've been on his case for the last couple of months. Go and get your PSA testing done. There was some debate about it. Some doctors don't want to do it. Some don't believe in it. But our group's experience has been that, again, myself and a few other guys didn't even know they had cancer. No clue. It was just the PSA testing. It was an indication that something was going on. How did I feel about my surgery? I guess my reaction was, how fast can I get this thing out of me, right? And why I'm talking about the surgery is that through joining the group, I wasn't aware there was things like radioactive pods that could be used or other treatments that don't necessarily mean surgery. But again, you have to be a candidate for these other things, wherever they may be. So just having that knowledge of there are other options there, I think is beneficial to guys. The values and benefits of support or family support are actually really important, I think. I went through some depression, having to deal with incontinence, other things that go on that I found that the medical people that I dealt with didn't really talk much about the after effects other than the incontinence. And a lot of guys experience other things other than that. The incontinence will actually, most cases will lessen. It won't be severe when you first have surgery. So that's really my experience. But what we do as a group, we try and get to the community and just say we're available, we're here, we offer support. We do not give medical advice. We're not doctors. We just share our experiences. And we also start our meetings by saying whatever is discussed is private in that meeting. We do not have any negative comments about the medical community. That's, if someone goes down that path, we ask them not to do that. So it's more or less a bunch of guys sitting around and some spouses attend, women, wives, etc. just sharing your experience. And I think that was the main thing that was very important about our group is you share your experience and you realize that other guys are going through the same thing as you. That's really the challenge we have today is that we have not seen any new people in the last few years. Our numbers are lessening every, from where they were when I first started with this. And it's kind of frustrating because I had a talk with our urologist not long ago, and I said, prostate cancer isn't going away. Guys are being diagnosed all the time. And we're asking even the medical community to let people know in our area that, support group exists for specifically prostate cancer, but HopeSpring offers all kinds of information for all kinds of people going through cancer. So that's really what our group's all about. We meet every fourth Tuesday at Rockway Center in Kitchener, and that's a hybrid meeting, so it's in person and Zoom. That's really what we do. So
Great. Thanks for sharing, Gary. Just a follow-up question. From those who have already experienced the prostate support group, did you receive any feedback from them, or how did their experience go through the group? How did they benefit?
Oh, similar to what I'm saying. A lot of guys went in. First of all, they didn't know the group existed.
Mhm.
Once they joined the group, they're interested in knowing what other guys' experiences were.
Right.
So in my case, I had surgery. Another fellow has been on active surveillance for 14 years because his numbers shown that they can monitor it that way. Another guy had just treatment through medication, no surgery. There's another fellow that was at the point where he couldn't have surgery. So the only treatment they were offering him was through injections, or I'm not personally aware of what those are exactly, but if to answer your question again, it's just the guys are pleased that there's fellows sitting there, sharing their experiences.
Right. Great. Thanks for sharing, Gary. And again, if anyone has any further questions as we go on, just do not hesitate to ask as we go. Okay, so the next part, I wanted to bring in Sean. So Sean, I just wanted you to talk about the men's support group, give a brief overview of what the men's support group is, its structure, and how it operates, and what are the benefits of the men's support group. What resources do you recommend to cope with stress and anxiety, and what do experienced or previous members say about the men's support group? So those who have already, took part in the support group.
Okay, thanks. I'll try not to repeat too much of what Gary's previously said because there is a little overlap. So I've been facilitating the men's support group since its creation in 2017. We were originally meeting in person at HopeSpring, and with the pandemic in 2020, the program has shifted online. We meet every second Wednesday at 6:30 p.m. over Zoom. We don't have the support group is open to both men who are caregivers and men who are patients, and we usually, the way we've structured it is that it's an open support group in terms of we don't have a particular theme on a given night. It's mainly just to have people come together and share their experiences, share where they're struggling, and a chance to connect with, more importantly, other people that are going through similar things, similar experiences, discussions about, this worked for me, this didn't work for me in terms of what of other types of support, and just to sort of connect at that level. I think the main benefit of the men's support group is I think, and this is just my opinion, I think as a healthcare system, we're very good at treating the illness, but not providing the psychosocial support to go along with that. And that is where a support group can be beneficial to many people, because it provides a safe, trusted space where people can share feelings, share experiences without being judged, and have a opportunity to get some feedback from people that are not emotionally involved with their situation. And just, I think, to realize that, hey, I'm not alone with how I'm feeling. I'm not alone in terms of the only one going through this. It's interesting when we can, when we have people join with similar cancer types, because there is, you know, some discussion on what their experiences were like, how they were different. Similar to Gary's group, where we do not, you know, we don't ask people to mention any specific negative medical experiences or any specific medical staff members or doctors' names or anything like that. It's, we just want you to share your experience and maybe be receptive as to some feedback that may help with that. And another interesting dynamic is when we have caregivers and patients or survivors together, because a lot of times their experiences complement each other, where they can, the struggles of a caregiver, a patient can relate to those same struggles or experiences in their life. So it gives a chance to form a little community. And what we saw in the beginning was the creation of that community, and we had a very good turnout rate, and I was able just to see some friendships develop, and how much people found value in that.
John, what's your attendance like?
Then or now?
Well, then and now, I guess.
Okay. In the beginning, it was quite high. We would, you know, for HopeSpring space and whatnot, but we would get 10 to 15 people out usually on a regular basis, and that has dropped significantly since the pandemic. So now, some weeks we don't get anybody joining. Some weeks we might get one or two, but it's that has been sort of an ongoing struggle, because with a support group, strength is in numbers a little bit. So when you have 2 to 3 people, it's challenging to try and keep that dynamic going, especially for a long period of time.
Yeah, we're experiencing a similar thing. And one thing I didn't mention, we're trying to have guest speakers on a pretty regular basis. We used to do that quite a bit. And we had Bobby Shagan, a doctor out of Hamilton, speak on a couple of occasions. We've had medical marijuana speakers. We've had other activities for our monthly meeting to try and make it more interesting. And we're slowly getting back on track with that this year. So yeah.
Oh, great. Great to hear that.
And Sean, yeah, just
yes.
a question. Why do you think post-pandemic there is much fewer people attending the support groups? Do you know any reasons for that?
Well, I can give you my opinions, and I don't think there's one reason. I think that people maybe have experienced sort of the online meeting or Zoom burnout a bit.
Mhm.
I think in a big way, meeting in person was an opportunity for men to get out of the house for an evening, for a couple hours, just to leave whatever's going on at home there for a couple hours and sort of disconnect from that. And online, they may not have that same feeling,
Right.
or that, that's, or get the same benefit as they would in person. Because I believe the need is there. I'm connected with Grand River Cancer Center, and understand that there is a need for more psychosocial support for patients and caregivers. So I think there are a few reasons for that.
Right. Sharing, Sean. And yeah, for the next question, like you already covered the benefits. But yeah, so what resources do you recommend to cope with stress and anxiety to members, particularly male patients?
Um, if if they can, to get connected to either some sort of social support, just for some personal one-on-one support. And there is great information through organizations like HopeSpring and other patient organizations that that can help provide information that may be causing the stress and anxiety, answers to those questions, or some strategies on dealing directly with stress and anxiety. There's things that we can do in our own life, such as there's many stress reduction techniques, meditation, exercise, affirmations, positive thinking. Like there are many tools and techniques that you can use. What I would recommend from my experiences is that of trying a couple and seeing what works best for you. Somebody may practice meditation every day and have found great value in it. For somebody else, that just is not a technique that may work. They may get some stress reduction out of getting out for a walk, or talking with a friend, or talking with a healthcare professional. So I would say start with your healthcare team, start with patient organizations, and maybe explore some of the more common stress reduction techniques.
Great. And finally, what do previous members say about the men's support group?
And this is where I guess I find myself a little baffled in terms of why more men aren't seeking out the support group, because all previous feedback that I've received, because I think it's important to get that feedback to make sure that you're aligning the group to the needs of the participants, is that they've all gotten a lot of benefit from the group, realizing I think the most common thing that I hear is, I thought I was experiencing this if it was a certain feeling, if it was just having cancer in general, but just the feeling that they were going through this alone, and just being in a room with other men, and being able to kind of feel safe to show your vulnerability, is, they've all said how beneficial that's been. And even something about what questions should I ask my doctor, getting some of that feedback has been given to me, where caregiver and patients have had a chance to speak to each other. They've realized that, hey, I didn't, for example, I didn't realize my wife may, or I didn't realize how I need to approach my wife as a caregiver, or what their needs are. So just being able to talk through some of these things and learn from each other, that's been common feedback from previous attendees.
Great. Thanks for sharing, Sean. It's really good information that you shared. Just another question I had in mind, during these support groups, the men's support groups, do you actively make like referrals to different programs? Maybe do you suggest like, okay, maybe you could try this program, or I think this would work for you? So do you do that during the group?
Yes, I'm always, because I should also have mentioned, in the past, I've also done Reiki treatments through HopeSpring. So I understand the value of those types of programs. So I've always refer people to Reiki, therapeutic touch, cancer coaching, or peer support, depending on what program was in place at the time, or even to refer them back, to their doctor to help arrange some other type of support.
Great. Great. And just out of curiosity, which program or programs have you referred patients to most during like your previous support groups?
The first would be what was then cancer coaching, or would now be peer support, would be top. And then either the Qigong or Reiki or therapeutic touch, depending on what resonates with people, but it would be peer support first, and then those types of programs next.
Right.
And
Great.
then on a few occasions where we've had men with prostate cancer, I have referred them back to Gary's group as well. But most of them had previously known about it, and I actually had a few people that started out in Gary's group that would also attend the men's group and sort of go back and forth, which was nice.
I've become good friends with one of the fellows that 10-year group at regular place, Brad Clark.
Okay, yes, I know Brad well. Yeah.
Great. Right. And just an open question for everyone. From the communications you had over the years with different men, different patients and caregivers, what did you find that they're looking for? What kind of support that they have expressed that, yes, this would be very beneficial for me, and I would like to see more of that?
I think in the case of the men's group, just with its structure, it was more of just the continued connection with other people with similar experiences.
Okay.
Because we kind of, the way I try not to steer the group too much, but I try and steer it towards more of the, I guess, psychosocial or the emotional side of things where people are struggling. You know, there's limited knowledge that I can help with dealing with symptoms or side effects, but it was mainly the emotional and the emotional piece.
Great. Great. Thanks so much for sharing that, Sean. So if there's anything else you would like to add, Gary or Dave, feel free to do so.
No, I think this has been a great session. It's just more information that's available to fellows and people in general.
For sure, for sure. So yeah, we're pretty much nearing the end of the session. So thank you so much again for attending today's group chat session. Hope you found it informative, a little helpful as well. So please feel free to ask any questions about what was covered during the session. Dave, any questions you may have?
I'd like to mention one thing that I didn't mention before.
Sure.
Our group has really partnered in a big way with HopeSpring recently. Sean, your president, has actually joined our steering committee. We're finding that a lot of resources that HomeSpring offers is something that we can't manage on our own. We just don't have the manpower to support our volunteers really. So I will mention that we've really, in the last few months, formed a pretty strong relationship with HopeSpring. You know, again, to try and fulfill our mandate of support and you know, community awareness. So
Right.
yeah.
One question I had is, Sean, was there any thought about like reopening the in-person meetings for the men's group there?
Yes, but I think I need to pass that over to Noelia and Moise because that's more on the administrative side.
Okay.
Yeah, and Hillary, like to take this one.
Yes, so I can speak on that. So yes, there are talks to having in person. I know that we're working with the city of Kitchener to see if we can get rooms to provide in-person option for our programs. Do you receive our news? No, Gary, you receive our newsletters, right? Yeah. So if you are part of Gary's group or if you're part of HopeSpring, we'll also announce it in our newsletter that we're going to be providing in-person programming, but we're hoping to maybe use a community center and to provide that option there.
Can I ask Dave, what would be your preference if you were thinking of joining a support group? Would you rather have it in person or online?
My preference is definitely in person, especially because my health is, you know, I'm not immunocompromised right now. So I had some reluctance that way. I certainly would prefer online, but yeah, in person is definitely preferable for me.
Sorry, I do have a question for I have two questions actually, if I may, if that's okay. A lot of so I work a lot with our members. Sometimes what happens is I'll talk to the wife, and the wife will try to connect HopeSpring with the with either their spouse or their partners to get some support. So there's two questions. First one is, how can we as a society work to break down, because sometimes what I hear is men don't want to focus on their health. They want to be a burden to the family by focusing on them. So how can we as a society help to break down that barrier around men's mental health and encourage more open, honest conversation? And the other question is, how can your loved ones support you in managing your mental health during this challenging time? Because that's the type of question I get asked often by their partners, and I think it might be good to know more from your perspective.
I'll answer the first question. This is why, as a group, we've tried to get out in the community in a bigger way, by attending the RV shows and setting up a booth and talking about our support group and also PSA testing. That's an activity that we're actually looking to get back into now, because things have opened up more from being closed during COVID. That answers that part of the question. We just want to have community awareness. How do you get guys to go to a doctor and talk about that? I think is really an ongoing challenge. I don't have an answer for that. I think maybe at an earlier age, I mentioned it earlier, I have a son who's 40. When I was 40, I had no clue anything about PSA testing. It was something I wouldn't even think about. So I think, again, that part of the education of just talking to people and encouraging that type of thing at an earlier age.
Mhm.
You know,
Yeah, I would agree with those comments too, Gary. I think the education piece is something that needs to continue. And if there is a way within that education to provide evidence-based information about the struggles that men go through, emotionally, with, just to reinforce that there is a need out there,
mhm.
that men do struggle with this, and just, I guess, that reinforcement, through information. It's great that you go to, for example, the RV show and get out into the community and are able to, because a lot of times, and relating back to the men's support group, I've seen where someone attends for the first time, they don't really know what to expect. They have a hard time opening up, and then by the end of the session, they're sharing everything, and in some cases are brought to tears just being able to do this, and have never, haven't explored these feelings before. So, I think connecting directly with these people to highlight the benefits and is useful, and hopefully, as mental health in general gets more of a spotlight, and that will help encourage people to seek out these type of resources.
Yeah.
And what was the second question?
So my second question was, how can your loved ones support you in managing your mental health during these challenging times?
I think that's somewhat personal, like
Yeah.
what's your relationships like? I was fortunate. I have strong support. Maybe other guys don't. I don't know.
Yeah. I would say, if I'm sure each case is very individualized, but in general, just to keep the communication lines open and keep talking, because if a guy goes into quiet mode and and internalizes everything, and your family isn't communicating that, hey, you seem troubled, or you don't seem to be coping well, just to open that dialogue up, and to say you may benefit from from going to a group, or seeking out some additional support. So maybe communication is a big piece of that.
Thank you.
Thank you so
found-
much for sharing. Yeah, Dave, go ahead.
So yeah, the one thing I found I'm fairly good at expressing myself to my family, but I found it hard to figure out sort of how they were feeling about my condition and getting feedback that way. And it took some time to figure that out and sort of balance that process in terms of getting them to open up about the different things that I was going through and how they were dealing with it. And they still are dealing with it all the time. So that's taken a little bit longer for me to figure out.
Mm-hmm.
Yeah.
That's a great point. Because a lot of times family and friends are concerned about asking a question that may, in fear of it's going to affect you negatively, or it's going to cause more fear and anxiety. It's easier just to, pretend that everything is positive and everything's going to be great. So yeah, communication is definitely two-way.
Yeah.
Yeah, I definitely agree. Communication and education are really important to kind of make sure, those who are going through like cancer, they know kind of options they have, right? So I think moving forward, we can. I mean, this session was really great, according to me. I think we can have another session. Maybe I can, invite some health professionals and guest speakers who can provide some kind of information about like say PSA testing or any other kind of screening or treatment options that men can have available to them. So that's a definite good topic that we can have in the future.
Mm-hmm.
Thank you for setting this up.
Yeah,
Yeah.
sure, no problem. So yeah, if there's no more questions, thank you so much again for attending. And my email is peersupport@hopespring.ca. So if anyone has any more questions about anything, feel free to reach out to me, and I'll be sure to get back to you as soon as I can. And Hillia, if you have anything to add, feel free to do so.
No, not at this time. Thank you so much.
Thank you.
All right, thank you. Thanks all.
Thanks, everybody. Nice meeting you.
All right, take care.
Thank you.
Bye-bye.
Take care.
Have a great day. Nice
You too.
meeting you,
See you.
Dave. and
Nice
Gary.
meeting you.
Bye.